Hello, my name is Dr. Arash Padidar. I'm an endovascular surgeon. I've been in practice for about 25 years or more, and I have been taking care of the side effects of obesity for a quarter of a century. Obesity is an endemic problem of the world. Approximately 70% of the people in the United States are overweight and obese. Some of the side effects of obesity are heart attacks, strokes, many types of cancers even, high blood pressure, diabetes, cholesterol, sleep apnea, osteoarthritis, gallstones, even birth defects have been linked to it. The conventional ways of treating obesity, as you know, are diet and exercise. These are the pillars of any treatments for obesity and weight loss. Furthermore, there's over-the-counter medications as well as prescription medications that have been used with some success. However, there are many side effects associated with medications. Obviously, there are many surgical approaches, such as a partial resection of the stomach, as well as placement of a sleeve around your esophagus, and even placing a large balloon in your stomach to take the space of food and making patients feel full. All of these have, with some success, worked. However, patients relapse in a majority of times. Approximately 70 to 80% of patients within a year relapse and gain weight again. Approximately 15 years ago, a single hormone was identified called ghrelin that is the only hormone that makes you feel hungry. This hormone is predominantly produced in the upper portion of the stomach. When ghrelin is produced, it will signal your brain to feel hungry, and therefore the acids in your stomach are secreted and people would like to eat. For the past 25 years, endovascular surgeons have been treating gastric ulcers and bleeding with a procedure called embolization. This is a procedure where a small catheter is introduced via the wrist or the leg, and it's advanced under the visualization of X-ray to the top of the stomach. At this point, small particles are injected in the top portion of the stomach to stop the bleeding. We have noticed over the past 25 years that these patients, one of the side effects that we see with it is weight loss. With the identification of ghrelin being produced in the top of the stomach, further research has shown that embolization of the stomach can decrease the production of ghrelin and make patients feel full. Some of the advantages of this new embolization procedure are that there is no surgery required, no anesthesia is required, there is no incision, you leave home with a band-aid on your wrist, it's 60 minutes, it's safe and painless. Patients ask me what is the biggest side effect of the procedure, and I tell them weight loss. There is very minimum complications with the procedure, such as bruising around the wrist, some tenderness around the wrist, and just feeling a little full even as early as 2 to 3 days after the procedure.